Hi, everyone. In this paper, we're looking at the knee flexor strength at 6 months after an ACL reconstruction using the hamstring tendon and how it can be predicted from that at 3 months. So the purpose of the study was to identify factors that were influencing the muscle weakness in the flexor strength after an ACL reconstruction. And we're establishing a clear cutoff value at 3 months post-op for the limb symmetry index and to exceed 90% at 6 months post-op. And the study design that we're looking at is a retrospective study. So in the participant section, so for this analysis, we only included those who we had data on follow-up data, because again, the main objective was to find that clear cutoff value at 3 months post-op for the limb symmetry index to exceed that 90% at 6 months post-op. So our inclusion criteria included those who had a primary ACL construction using that hamstring tendon autograft, those who had a preoperative Tegner score of 6 or higher, and also those who had a postoperative follow-up at the hospital in which this study was conducted in. And our exclusion criteria were those that lacked that muscle strength measurement data at 3 or 6 months post-op, and those who had the LSI limb symmetry index between 85 and 90%. Again, this kind of just reiterates our inclusion and exclusion criteria. And the data was from 2015 to 2023 of the patients. It was 8 year. Prognostic factors influencing the study were those that the preoperative waiting periods, the Tegner activity score, meniscus or other cartilage injuries, the demographic values, of course, preoperative knee range of motion, and that limb symmetry index. So outcome, we were looking mainly at this limb symmetry index, which essentially is that comparison of the knee flexor strength in the affected versus the non-affected leg. And we're looking at the 3 months predictive value to be able to predict that at 6 months. And those who had a limb symmetry index of 76.9% at 3 months post reconstruction, that was an indicator for achieving 90% LSI at 6 months.
As far as validity goes, the investigators operationally define the sample, and that was just the inclusion and exclusion criteria that was mentioned earlier. And then were the subjects representative of the population? We were unsure on that because only some of the demographic information was included. So we aren't sure of the demographic or the pathology of the participants that were not included in this sample. Then this is just some more information about the demographic of our sample. And then, did all the subjects enter the study at the same time? We said yes, because they all performed prehab beforehand, and then afterwards they all followed the same exercise program that's listed down here in the table. And then, was the time frame long enough to capture the outcomes of interest? We said yes, because the study looked at knee flexor strength at 3 months after the ACL reconstruction with the semitendinosus graft, and then 6 months as well. And then the 6 months is an appropriate time frame for the recovery from the semitendinosus to heal from the graft. And then did the investigators collect outcome data from all enrolled subjects? We said yes, because of all the 148 that were included, they received outcome data at 3 months as well as 6 months post-op.
All right, as far as the operational definition of the outcome criteria, it is as follows. So we've got the limb symmetry index, and the equation is here. So basically, limb symmetry index is just looking at the involved limb strength compared to the non-involved limb strength. So it's just a ratio there. And in this study, we're defining an LSI of 90% or more at 6 months as the achieved group, and then an LSI of 85% or lower as the non-achieved group. And then the participants that we mentioned earlier that were excluded for the LSI between 85 and 90%, that's because they're kind of in a gray area where they could be classified as ready to return to play or maybe not. So they just kind of left those out. As far as the outcome blinding here, we're not sure because a lot of the prognostic factors were objective, like meniscus tears or other implications like that seems like the researchers would probably know, but they never explicitly said if they did or did not know. As far as dividing the patients into different subgroups based on their differing prognostic estimates, we said no on this one because they did not classify any participants into groups until the very end, which was just based on the results of their LSI at the very end. They didn't look at, say, if some participants had a meniscus injury and then classify them in their own group throughout the study. And then the investigators did not confirm their findings with a new set of subjects. And here's just an overview of all our points on the validity of this study.
All right, so when looking at the results, you could look at the two factors that had a p-value less than 0.05. That's preoperative waiting period, and that's the 3-month limb symmetry flexor factor as well. So if you look at there was a portion in our paper that said the multiple logistic regression analysis was only pulled two factors, and it was those two factors because that p-value was less than the 0.05. And then that means the regression coefficient was statistically significant as well. So those are going to be our two important results. This is just our area under the curve. As we talked about in class, once it gets above 50, you could consider it useful and more than just an educated guess, because 50-50 would be like flipping a coin, and an AUC value of 1 would be perfect. So I would say this one has a pretty good AUC value since it's a little bit more than that 75 percentile. Clinical implications. So basically what this study was doing is looking at the limb symmetry index at 3 months and seeing if that's predictive of a LSI at 90% at 6 months post-op. And we found that 76.9% of at 3 months was going to be favorable to get you to that 90% at 6 months post-op. And really what that 90% is that's one of your criteria to give you clearance to start a return to play protocol. So very important there. Preoperative waiting period was also another factor extracted, basically stating that the shorter the waiting period, the better. And then the big one was everybody focuses on knee extensor strength with ACL, but this paper kind of reemphasized what we're saying is that knee flexor strength is very important and can be predictive with the success of the graft as well. Generalizability, great generalizability if we're using a hamstring tendon graft and gracilis graft. But really with any other graft, you're going to get different data because different stresses and whatnot could lead to different outcomes. So other ACL grafts, this doesn't have the best generalizability, but it is useful for this specific population that will use that semitendinosus graft.